coming?
It's been 8 years, and I remember it was actually my physician that recommended that I come here, and you know who he is, and just not to divulge yet, but 8 years ago, I was looking at a secondary treatment for prostate cancer. I was diagnosed with prostate cancer in 2001, and that was 14 years ago. And at the time, I was going to a support group, and the men there that had advanced prostate cancer had a treatment called hormone ablation, or basically it was chemical castration. And I already had surgery and radiation, and I failed both. Cancer came back both times. And what I was looking at, I figured that I had about 4 years from the time I started coming here till the time that I had to go on that treatment. And when I saw the other guys in the support group that had gone on this chemical castration, they lost muscle mass, they grew, they called it gynecomastia, which is, they grew breast. It was all secondary characteristics, female characteristics that they started developing. I said that, I needed to bulk up and get strong to be able to take that, because at the time, once you went on it was basically medication called Lupron. Once you went on Lupron, you stayed on it basically on and off for the rest of your life, and that was the treatment, and that's the only treatment now for advanced prostate cancer. So that's what that was the plan. So after coming here, Dave was harping on me about drinking and diet and all that kind of stuff. And I thought he was nuts. I mean, I never believed anything he said until it became apparent that I was doing all this work, working so hard. So first thing he did, after a year, he got me off drinking and got me on a better diet, a cleaner diet, less sugars, more protein, less carbs, things of that nature. And then all the array of supplements. So there was things that I was needing. I was deficient in magnesium and other things. So we worked on that over the years. And something really strange happened within a few years of starting to come here. There's something called the PSA doubling time, and basically that's the calculation that urologists use to calculate within a period of time how fast your PSA doubles. And that's an indication of tumor growth. So if you had a PSA on January 1st of 1 year of 2, and then next year it was 4, your PSA doubling time was a year. That's basically what I was looking at. My PSA doubling time was about a year, maybe even less, when I first started.
Right.
But as we tracked it over time, something really strange happened, which my urologist said, he hadn't seen too many guys that this happened to, is that rather than my PSA doubling time actually shortening, it actually started growing. And after working here for all that time, my PSA doubling time went from 1 year down to 4 years. And it's hard to say what is the reason for it, or what can we have a direct cause and an effect of what's happened. But it's so odd that it would even go to that length of doubling time, much less it's starting to decrease now.
Right.
So it's not that this is a cure for prostate cancer, but as I've seen my urologist and my oncologist at Roswell, that the thought is now that I'll have to be followed up for the rest of my life for it, but the thought is that it may not ever become a problem where I should live a normal lifetime without having to worry about the going to that next stage of treatment, which is chemical castration, which is horrible. I mean, it's the side effects are terrible. But this really all started because I'm a Vietnam veteran, and I have Agent Orange related issues. But 5 years before I was diagnosed with prostate cancer, I had a heart attack when I was 47, and it was a severe heart attack. In fact, from the point where they did an angiogram in the afternoon, and they said, well, we want to operate midnight because it was that serious, because they thought I was going to die that day. So really, the benefit, the reason why I came here was because of the prostate cancer. But because of all the work that I've been doing with the diet, the omega-3 fatty acids, working on the milk thistle that helps my liver work with the statin drugs that I've been taking all these years. What's happened is that my real main health problem was cardiac, was heart disease. And when I was first had the surgery in 1996, the surgeons told me that within 10 years, I would probably have to have another bypass, because at the time, the time that bypasses were functional was 10 years. And within that time period, I was looking at a second surgery.
And you had multiple bypasses.
Yeah, I had 6. No, I'm sorry, I had 5. I had 5 bypasses at the time. They were looking at a 6th one, but I had 5 bypasses, and they diagnosed it as severe coronary artery disease. I only had, at the time, about 10% of my artery flow. My right coronary artery was 100%, my left was 90, and my circumflex, was one on the back, was 80. So you work that out, it's like about 10% of the flow of your heart was functioning. And I had a very small heart attack, just enough for them to be able to detect it. And the upshot was that the surgery, when they did the angiogram, I remember the cardiologist, they pushed the dye in and they traced your heart, and he goes, I heard him say, "Oh my." It's like it's not what you want to hear your cardiologist say when they're doing a test. I was almost 100% blocked. They call it the widowmaker, with a right coronary blocked like that. But what happened though was, after 10 years, which was 2006 for me, I kept getting better and better. My cholesterol was coming down between the exercise, the diet, omega-3s, statin drugs, obviously. That I had a cardiac scare about 2 years ago, and it was an abnormal stress test. And normally angiograms, most people don't know that angiogram is more dangerous than open heart procedure. And they did a stress, they did a echo and all that kind of stuff, and they found that there was an abnormal wave in my cardiogram. So they took me in, they did the angiogram, and I remember my wife said later, the cardiologist came out to her and said, whatever he's doing, tell him to keep doing it, because his bypasses are pristine. That was a direct quote. Now, cardiologists don't usually say that kind of stuff. They don't usually use terms like pristine or whatever, but he said that tell him to keep doing it because his bypasses are wide open. And then I got the report later, and you go through all the technical mumbo jumbo. Basically, they were free, they were clear, and it was all really a benefit of the lifestyle, the exercise, getting rid of alcohol in my life, getting rid of the sugars, getting balanced with supplements, and really doing the level of training. And not only just, I used to do all cardio, and that really didn't really cut it, because I was really heavy cardio even before my heart attack. Well, because of the weight training and also throwing in some cardio, that my cholesterol profile is like 125 now is my total cholesterol. And the numbers that I'm getting now indicate that I'll never have another heart attack, and the possibility is there's really no time limit on the heart disease, that it should progress at all. It should stay stable for the rest of my life. So I came here for prostate cancer, but then really realized that what changed was going through all these health awareness, lifestyle changes, changes and I've never weight trained before, really addressed my main problem, which I forgot at the time, was cardiac. And that was sure to be the most deadly disease that I had. But now, from keeping in check with my physicians and keeping on top of everything, that I should live a normal, healthy life. And another stupid thing that your husband says is just crazy, this stuff he says. He says, you should be able to maintain this straight into your 70s, 80s, whatever, until you drop dead. I'm like, oh, that's good news. Oh, thank you. I like it.
I know when you started, you had mentioned that you were mainly doing cardiovascular training.
Mm-hmm.
What did you feel like when you came and Dave explained to you the approach that he wanted to take, where it focused a lot more on resistance training.
Well, first of all, I didn't believe a word he said. I fought him every inch of the way.
I remember.
Yeah, I mean, I was terrible. I was a snot. I know that anything he said, that it was, prove it to me, prove it to me, prove it to me. And we would have discussions, and he would slowly and patiently deal with my obstinance and my disbelief. But after a year, I started going, okay, maybe he had something. The real telling point was getting me off beer. Like I said, I would give up my first male-born son before I'd stop drinking beer. But the thing is that he did get me off alcohol, and a lot of things started changing. And I found that I was able to do many more activities that I couldn't do before. And since then, obviously, that I've started rappelling. I've gotten into competitive ballroom dancing, and the strength, especially from the standpoint of posture and movement, has been so profoundly different. When we did the initial assessment, we sat down. Remember, we sat down and went through the, as a body diagram, you circle all the body parts that are screwed up. Well, I think I circled just about every joint, my knees, my back, everything. Shoulders. I was, my knee was terrible, and that really prevented me from hiking, which is one thing I really love to do. And since then, climbing and rappelling, that I've taken courses, in Canada, up in Canada, to learn how to do all that technical climbing, safely. That a lot of those issues have gone away. My knee is no longer a problem. I mean, it's just like it was a problem from college, and it was really amazing to me how we systematically worked on getting the muscle stable, getting the right exercises so that I could do the kind of activities that I really enjoyed. And the real thing now that I'm doing, as you probably well know, is that I'm doing competitive ballroom dancing, which is, most people, it's not a sport, but from the standpoint of the kind of posture, control, and positions, is really difficult to do.
Yes. Yeah. And very difficult to do if you have problems with your knees.
Yes,
especially.
and your back too, because a lot of core strength, a lot of glute strength is required for a lot of the poses, and especially in a lot of the movements that require a lot of hip movements. It's if you have any problems, back problems, or you don't have strong core or glute, you're not going to be able to do that kind of stuff. And sometimes you're going to be dancing like 25, maybe even 50 heats in a day, and that takes a lot of endurance that really this gym really affords me the ability to do that kind of stuff and things that I love. But it's like going back to what you said initially, what Dave said. I mean, everything he said, I fought him, and then logically worked it out. We discussed it, and then finally it proved what he was talking about. And we were very careful about the way we approach things. We would only make one change at a time. For example, if because of the statin drugs really have a problem with your liver, because they process cholesterol back with your liver, and they do they mess with your liver. Well, we added milk thistle, which is something I never heard of. I'm looking at him and going like, okay. But what we did is, prior to everything that we did a lab test. We did a liver function test. I have that done every 6 months. And then I watched as the liver function started lowering and became normal again. And then my numbers for my cholesterol became better. My LDL came down, my HDL went up, my total cholesterol was lower. So we just did one thing at a time to see how it worked. And that was just an example of it. And then we added in omega-3s.
Right.
That also helped. So these are not just like what they call anecdotal things. These are actual things that we looked at, just changing one thing and taking a look at actual lab values.
And watching the results.
And
change, right?
Yes. And it's the same thing with lab results for my PSA. We've watched the numbers change and come down. And these are measurable, tangible health benefits that I was on a trajectory before that I would have been on, Lupron now
Right.
for at least 4 years. And I would have lost muscle mass. I would have, had secondary female characteristics, that kind of stuff. That all the nasty side effects of that medication that a lot of the guys who are advanced prostate cancer would have.
Right.
I don't have those now.
I remember when you first came, Dave was very sensitive to the fact and understood why you were so cautious to making changes for everything you had gone through.
Mm-hmm.
I think anybody that had gone through even some of what you had to deal with, you weren't real confident in trying new things and going against anything that maybe you had thought.
Yeah, because
before.
back in 1996 when I was diagnosed, a lot of the conventional wisdom has changed since then, and no one really looked at weight training as being a venue for cardiac recovery. But since then, in the papers even, there's been studies that have come out that have talked about resistance training or weight training and the benefits to a cardiac program. Most conventional wisdom in 1996 was low fat, low cholesterol. There is no such thing as a healthy fat. Take the statin drugs, knock them down chemically as much as possible, and don't do anything other adjunct types of thing. Like, supplements were,
Yeah.
that was like voodoo science. But I think that
And the exercising that they typically talk about is cardiovascular.
absolutely. And I had been on, prior to coming here, I had been on the treadmill almost exclusively. And, biking and things of that nature, skiing, cross-country skiing. But I never had the upper body strength or core strength. I still had all the issues involved with all my joints, the shoulder and hip joints that go along with aging. Mm-hmm. And of course with constant wear and tear, because I used to be a runner. And that kind of shock to the system was always evident on my joints. Mm-hmm. So, but I would consistently do the type of treadmill. And what was happening was that I would do like maybe 50 minutes, and the meter on the treadmill would say I did like 800 calories. But I almost got so habituated to it that it wasn't really a challenge. I did it, day after day after day. I would maybe do 5 days a week at a time. And that was the conventional wisdom at the time. That has since changed, and there's been a lot of research about that weight training, the kind of stress it puts on your heart, and the kind of let's call it cardiac defect you get. I couldn't get my heart rate up as high as I do on the treadmill as I'm doing in some of these exercises. Some of these sets that I do where I, max out the machines, I don't think I can stress have that kind of stress that I have with cardiac. There's no way.
Right.
You can't do it. I have to be running up at a 15% grade for,
And your joints for your
yeah,
joints.
and that wouldn't work.
Right.
And that would be completely counterproductive, because then if I don't have the stability of the joints and the pain, I would avoid, biking, I would avoid hiking, I would avoid dancing, I would avoid, rappelling, I would avoid all those things that I really enjoy. But right now, with the kind of shape I'm in, especially with the stability of the joints and the core strength that I have now, there's really nothing I can't do at 60, well, I'm going to be 66 in May. There's nothing that I can't do now that I couldn't do in my 20s.
Right.
So it's not like it's like a fountain of youth or anything, but what it does do is it gives you the capability to continue to do the things you love to do them safely, and do them within reason. I mean, I can't do the same, I can't hike the way I did when I was 20, but I still can do a lot of things that 20-year-olds find difficult. Like the last time I was doing the rescue course up in Canada with my instructor, There was 5 other guys who were 20. Here's this old man who was in his 60s. And so I rappelled down a 70-foot cliff, and the guys are going like, how'd you learn how to do that?
Right.
I'm going, and they thought they were dying doing it. So,
Yeah.
but there's no real limit as to what you can do with the kind of strength and endurance that you get from this kind of program. And
But I think the reason you've been successful, and I think you would agree with me, is you came in here obviously for some very motivating reasons to keep you going, but you have stayed very consistent. You were very patient through all of it, but you followed the program. You did the work. Dave guided you and certainly developed some of the program for you, but you're the one who came in, stayed consistent with it, and you're reaping the
benefits. Yeah, and it's true. The thing is that fear sometimes is a great motivator for fear of death. I guess that would be the thing. But it was fear of losing capabilities. What's going to happen when I go on Lupron, or that what are going to be the side effects? But as fear turned into more of, this is what I really love to do. This is the kind of conditioning and lifestyle that I want to live, that it gives me now the opportunity to continue to do in retirement the kinds of things I couldn't do when I was working. I mean, a lot of times when you're raising a family working, you don't really have a time to do a lot of the things. But now in retirement, it's like it gives me opens a whole new door to activities that I can continue to enjoy. I mean, I never want to stop hiking, and I want to stop climbing and rappelling and doing the technical climbing that I do. But I just started dancing competitively just a year ago, and I was this is really fantastic. It opens up a whole new level of discipline that and precision that I really enjoy. And if it wasn't for the training that I had, I wouldn't be able to compete at the level I'm competing at. And this is a national or international level that I'm competing at. So the kind of things now is that rather than being motivated from fear, I'm motivated from the kinds of things I like to do, adventurous, fun things. It's like you're living life at full speed. You're living life out loud. It's not a shy type of thing. You're out there, and it's a great thing. So
which is really, that's Dave's whole mission, is to help people become stronger and healthier so they can live an active and full life.
Full life, and that's exactly what I'm doing, because days goes by that I don't even think about being a heart patient or having cancer. In fact, yesterday I had 3 hours of dance lessons. So I'm preparing for my next competition in June up in Niagara-on-the-Lake, and I did 3 hours. How many people can do 3 hours on their feet doing a lot of the kinds of moves that you do in competitive ballroom dancing and not have a problem? I had no problem. I left there and I was in great shape. So it gives you the kind of muscle endurance that you can do, because a lot of the things that you're doing, it's just not you're doing a cardio for like 40 minutes and done. You're holding poses, you're down bending, you're into poses that require muscle and core strength. 3 hours I can do that. That's an amazing gift that I have.
You worked hard.
Well, I did, but now I can do it. And my instructor said, "Can you do like 2 hours?" That body, I go, "Nah, that's no big deal." No, it's no big deal. But that's the kind of benefits now I have, and I know that it's because I worked hard. But I think it's also helpful because Dave is a real motivating factor too. I mean, he's a pain in the ass too, but he's a motivating factor too. But the thing is that his patient way of doing things and listening and knowing he's got an objective.
Yes.
He's out here. He isn't showing his cards either. He's like, he's got back here. He's going like, okay, what do you got here? He knows what he's going to do, and then he lets you come to his way of thinking. It takes a while. It took me about 4 years.
Yeah, because life changes don't happen overnight.
Yeah, but he's got a way of thinking that I think most people don't. And time again, I've challenged him right down the line. This is the stupidest thing I ever heard, Dave. This is stupid. Until I come to the aha moment and say, okay, I see what you're talking about. So we talked about muscle recovery and about why that's the best way for weight control. And then we started realizing that it was building muscle, then the repairing, and then what happens when you challenge a muscle, it gets bigger, and then it then consumes more calories, and then does all that. I'm going like, oh, that's logical. That makes sense. And then, but I had to experience that for myself, building the muscle, before I said, I thought he was nuts. But then when you experience it, you realize that this is the right way to do it, and it's worked well. I don't see really any end to what I'm doing. I saw my our good friend, our chiropractor Frank, yesterday, and when I was telling him how much I was dancing, he says, "Are you still training?" He was like, "Oh yeah, I wouldn't stop that." So he thought I would drop the training over for dancing. No, there's no way. I couldn't do it. There's no way, and I couldn't keep up my schedule or the things I want to do if I wasn't training. So.
Well, we're immensely proud of you.
Well, thank you.
And I know that Dave has really, I know how you feel and how much he's helped you, but you've blessed him as much as you feel he's blessed you. So we're really proud.
Thank you. Thank you very much. It was my pleasure. And you're not going to get rid of me anytime soon.
And we hope not to.